Therefore, for elimination, the best thing is mass drug administration.
One of the patient, he said, I should have taken once that drug dose. I would have avoided taking and coming to this health center for everyday pain.
I wish you a very warm welcome. Many thanks for joining us today. Today we're going to be talking about filaria and how to raise awareness about it, and also how to deal with the challenges that lie ahead. Without further ado, let me introduce two of our guests this evening. I'm joined by Dr. Bhupendra Tripathi. He is the country lead for elimination programs, neglected tropical diseases at the Gates Foundation India. I'm also joined by Ms. Rajshree, who leads the social mobilization program at PCI India. Dr. Tripathi, Rajshree, many thanks for joining us this evening. Could you try and expand on our understanding about filaria? How does it spread? The mosquito responsible?
So, filaria is a disease which is basically known as neglected tropical disease. It's a disease of parasite, worms, and mosquito is the vector which transmits these worms. Just like any vector-borne disease, we have to understand which are the vectors we are talking about and what are the breeding sites for such vectors and how much exposed humans are. So, any area where we have waterlogging is a high-risk area, point number one. Second, mosquitoes are of various types. We have Aedes, we have Anopheles, we have Culex, Punsonia. This particular disease is spread by Culex.
Right.
And Culex has a peculiarity. It breeds in the normal dirty water. Any place where you have an open drain with some organic content inside, it breeds very well. We still have to work around vector control.
What are some strategies for reducing mosquito populations?
As Dr. Tripathi explained about the conducive environment, the best thing is about taking care of the surrounding, avoiding the stagnant water, and also keeping the cleanliness in and around household. And I would say the best simple, in my language I say small doable action, is using mosquito net.
What are some of the strategies and initiatives that have held the most promise so far?
One thing which has happened very, very intensively is the community engagement part, wherein government has shown real intensive support in terms of intersectoral convergence, and intersectoral convergence actually leads to the whole Jan Andolan, wherein various departments which has got last mile connectivity have come up together, and they have converged together to raise awareness about this disease, also about the prevention at the community level.
Once we are aiming for elimination, we need to have two things very clear. One thing is that where is the problem? Essentially surveillance. So we should have very strong surveillance to understand which are the areas where currently these transmissions are going on. And the second is, what is the remedy? So this program, the remedy is mass drug administration. It is basically a preventive chemotherapy where you give everybody during the same time period some drugs which people consume, and this microfilaria is killed from everybody's body.
Rajshree, you spoke about vulnerable populations. As you reach out to these populations in a bit to either raise awareness or even administration of the MDA program, the Mass Drug Administration Program, what are some of the challenges that you face?
Around a decade before, there were challenges like in the urban areas, the consumption was low. In the hard to reach areas, the consumption of the antifilarial drugs were low. Low drug consumption among the children. Lot of interventions and initiatives have been taken place, and these problems are getting converted into smaller solutions, and the progress is being made. Say for example, the urban areas were a challenge, but then now the focus is on streamlining micro plans. Very intensive micro planning is being done, wherein none of the areas are missed. There are a lot of mobilization taking place so that people are aware and they come forward for drug consumption. Another challenge was there are less number of frontline workers in the urban areas, and hence the schools, the colleges other existing resources and platforms, they are engaged so that the community is aware and they come forward for consuming the drugs. And as Dr. Tripathi shared, that prevention is the only way to move towards the filaria elimination. So how these communities are aware about the prevention, those interventions are taken.
Dr. Tripathi, in your years in combating filaria so far, what has been that defining experience for you that propels you, motivates you, or even shook you, for that matter?
I went to one of the villages in Bihar in the initial days, and I'll give you an instance where the mass drug administration was happening. The drug administrators had just moved out of that house, and I went to that house and I asked, "Okay, friends, have you received the drugs and have you consumed?" There was a young girl, like 17-year-old girl. She came up front and she said, "Yes, everybody has received and we all have consumed the drugs." I said, "Very good, that's great." And all the family members were standing there. I said, "Okay, fine, I have a strip. It will just be kept on the lips and it will change the color if you have taken the drugs." She ran inside. So,
right.
And then gentleman, like his uncle came to me and he said, "Sir, which program are you from?" I said, "I'm from the health department and working on Filaria." Then he said, "Can you please come inside?" I said, "Why?" He said, "This girl who just went inside is actually having swelling in her own leg." I was shocked. I said, "Oh my goodness, this girl, poor girl, is still having like this swelling and she is giving us wrong information of mass drug administration."
Right.
We went back inside, like basically, and we had a female doctor with us and she examined. She was having symptoms of filariasis. We asked the father that, "Okay, what are you doing for this?" So he said, "We are going to a homeopathic doctor and we are taking drugs. It is costing 1,500 per 15 days. And I said, "How many days have you been, using these medicines?" He said, "More than 1.5 years." So I was so, feeling sad that just because of lack of information,
Right.
had this family understood the importance of this mass drug administration campaign, perhaps she would have never suffered with this disease.
You're prevented reaching that stage
Absolutely.
of acute inflammation.
We need to communicate to the community, "Well, friends, you may be looking healthy, but it's not possible for government to test each and every individual whether you are having macrofilaria or not.
Right.
But the best part is we can take these drugs once a year." And mind you, these drugs not only save us from filariasis, but this albendazole also helps in deworming the intestinal worms, which cause malnutrition.
Right.
So converting the whole disease into simple story and then linking with the lifetime experience, the day-to-day life, which actually makes them understand that there is a risk and I should be getting prevented from it.
How effective have patients been as advocates in the elimination program?
I feel patients can play a very, very vital role. And in fact, in the program, already the Patient Support Network,
Right.
they have come forward and they have been talking about their personal experience with the communities, which is actually making the communities aware about the risk and also the consequences. And especially for the people who do not get convinced
Right.
that they do not understand that they might be having microfilaria in their body,
Right.
and then they are asymptomatic.
Right.
So these patients can become a very, very good advocate at the community level to convince communities to consume the antifilarial drugs.
Right. And because it's a more familiar person, they
Yes.
find it easier to relate in terms of language, etc.
Correct.
If one of my parents has it, will I also get it?
Many a times people have felt it's a genetic disease.
Right.
Assuming grandparents had, parents had, I am also having. Just go back to what I said about the mosquito. Mosquito, where does the mosquito live? It lives within
In
the
the
house.
vicinity. Right.
So what happens if the mosquito is biting me? The mosquito will bite her. The same mosquito bite you.
Right.
Assuming we are 3 generations, the mosquito will keep on biting and transmitting the microfilaria. So by design, because the disease is spread by a vector, and if you are living together in that vicinity, it may happen the transmission is always maintained. Therefore, it's a risk, but it's not a genetic disease. So
Right.
if my parents had this problem, but if I have been consuming this microfilaria drugs like MDA drugs every year, and my surrounding people have also taken, then I am at no risk. I am perfectly safe.
There is a list of countries that have eliminated filaria. When do you see India taking pride of place in that list as well? What is the timeline? I do believe a lot of work has been done. We have managed to eliminate it quite significantly in certain regions. But in your mind, what is the timeline that we're looking at?
The canvas, the affected communities in the endemic area is very huge. WHO's roadmap for elimination is 2030, but then our country's political leadership and the willingness is so high that it is being decided that at least the MDAs will stop by 2027. And there are like new strategies which has come up, and the program has come up with 5-pronged new strategies which will actually enable and also accelerate the elimination status. Also, another thing which I must share is about the block strategy. As the canvas is high and huge and big, getting into block strategies and doing the intensive work in a smaller unit will definitely help the program accelerate and get into the winning status soon.
Many thanks, Dr. Tripathi and Rajshree, for taking out the time to take us through this. Your insights have been invaluable, and your experience shows in how much you really know about the subject and your domain expertise in the subject. I wish you good luck in your endeavor, and we all hope to become a part of this fight for elimination of filaria. And I would also like to say a big thank you to our audience for joining us in this conversation. Please do read up more about filaria. You are also going to serve as advocates in raising awareness. So in your own personal capacities, please have a conversation about filaria. Like Dr. Tripathi said, speak to the people around you. A 1 degree of separation of information can reach 6 degrees of separation of information, and we'll all be counting on that, because as we've understood from this conversation, awareness and communication is half the battle won. Many thanks for joining us, and wish you all the best.